hormones with cholesterol as their main precursors. The source of estrogen are the theca interna of the Graafian follicle, which is a major source, and granulosa cells of the Graafian follicles, placenta, adrenal cortex in small amounts, and testis in small amounts. Secretion. There are two peaks of secretion, one just before ovulation and one during mid-luteal phase. We see the actions of estrogen effects on the female genitalia. It facilitates the growth of ovarian follicle and increases the motility of uterine tubes. Their role in cyclic changes in endometrium, cervix, vagina are discussed above. They increase uterine blood flow and have important effect on the smooth muscle of uterus. Estrogen increases the uterine muscle and its content of contractile proteins, and muscle becomes more excitable. Under the influence of estrogens, the muscle becomes more active and excitable. The effect on the endocrine organs. They inhibit the secretion of both LH and FSH by negative feedback mechanism, but also produces LH surge by positive feedback mechanism. They increase the angiotensin and the thyroid binding globulin levels of the blood, and high doses of estrogen prevent conception, which is seen in a morning after pill, which is mainly prevents the implantation. Effect on the CNS. Estrogen is responsible for the female type of behavior, and also it increases the libido in females. It also increases the proliferation of dendrites of neurons and the number of synaptic knobs. You see their effects on the CVS. Estrogens have significant plasma cholesterol lowering action and thereby rapidly produce vasodilatation by increasing local production of nitric oxide. These actions inhibit atherosclerosis and contribute to low incidence of myocardial infarction. However, large doses of orally active estrogen promotes thrombosis because they reach the liver in high concentration and alter hepatic production of clotting factors. Their effect on the female secondary sexual characteristics. The body changes that develop in girls at puberty, in addition to enlargement of breast, uterus, and vagina, are due to estrogen, which is called as feminizing hormones. Women have narrow shoulders and broad hips, thighs that converge, and arms that diverge, that is carrying angle. So this body configuration plus female distribution of fat in breast and buttocks is due to estrogen. The effect on the water and electrolyte metabolism. Estrogen causes some degree of salt and water retention. The effect on the breast. Estrogen produces duct growth in breast and is responsible for the breast enlargement at puberty in girls. So they are called as growth hormone of breast. Estrogen is responsible for pigmentation of the areola. Growth of pubic and axillary hairs in females is mainly due to the androgens. Coming to progesterone. Source of progesterone is corpus luteum and placenta, where placenta is a major source. The testis and the adrenal cortex. Secretion. In men, plasma progesterone is 0.3 nanograms per ml, and in women is 0.9 nanograms per ml. During follicular phase, which increases by 20-fold, and it increases 20-fold during luteal phase, and in follicular phase it is 0.9 nanograms per ml. Actions of progesterone. It helps in the basal metabolism, that is basal metabolic rate. Progesterone increases the body temperature due to its thermogenic actions. In the luteal phase of woman, the basal body temperature is raised due to the progesterone from the corpus luteum. On respiration, it stimulates breathing, which may result into a decrease in the alveolar PCO2. On endocrine glands, high levels of progesterone inhibit LH secretion. You see their action on the reproductive system. Progesterone is responsible for progestational changes in the endometrium and the cyclical changes in the cervix and vagina. It has an anti-estrogenic effect on the myometrial cells, decreasing their excitability. It also decreases the number of estrogen receptor on the endometrium. On the mammary gland, it causes the development of the alveoli and mammary glands. Along with estrogen, it prepares the gland for lactation. On renal system, large doses of progesterone produces natriuresis, probably by blocking the action of aldosterone